Dr. John Owings from the Kilted Chiropractor. Take the time to subscribe to my channel and like my videos. And this month, October, we're having some fun. We're giving away a free t-shirt. So we're looking for comments. Tell us what you like. Tell us what you'd like to see. And we're going to choose randomly from each video a person to send a t-shirt to. So let us know, claim your t-shirt, and we'll see you on the channel. I feel good.
Yep. Got a lot there.
That released really well.
Yeah, so I came in originally probably at the fairly early on in my pregnancy, and specifically for some hip pain that I was having as a result of everything kind of loosening up as happens in pregnancy. And I've been coming in every week since, getting adjustments, taping and massage, and it's really helped just keep all the space. So when you get adjustments during pregnancy, what it does is it helps create a little bit more space for the baby as well, which is ideal, and it helps you to not feel quite so clenched together, I suppose. I feel like every week I start to fall apart a little bit, and then by the end of the week I kind of come in Friday and get to relax and get fixed.
Dr. John here. Today we're on a casual Friday, and I've got one of my patients here who's expecting. This is Nika, and so we're going to do some specialized taping today with some rock tape on top of our adjusting. So Nika's you've been here for a few months now.
Yeah, I started coming, I want to say maybe 5 months into my pregnancy. Because I was starting to get some, like mostly the hips were bothering me the most, I would say. And
then we've started the chiro, you've been doing massage therapy, you just had a massage, how do you feel?
Good. I would say that that's like now something that I do every week just because it loosens me up. And I feel like by Thursday, no, usually Wednesday, I feel like I'm starting to fall apart again. So it's like coming back and just getting readjusted every week is nice.
Pregnancy is not an easy process.
Yeah.
I do understand. I know it's the low back and the hip we've been kind of fighting. And then how's the neck, shoulder feeling today?
I don't know exactly what's happening, but my shoulder, I tend to have some stuff on my right side with my shoulder, around my shoulder blades, and that's been getting more consistent. I think it might have something to do with a rib.
So we're gonna just kind of fix everything.
Yep.
Then we're gonna get you taped up like a little mummy. Might be a pun in there, I don't know yet. But you're gonna be taped up. I'm gonna try some new taping today too, so we're gonna see how your belly feels and everything.
Yeah.
So let's switch tables. We'll go over here, we'll start with our assessment. Any fun plans for the weekend?
Yeah, my family's in town.
That's always nice.
So.
Well, we want to make sure you're walking and having a good time.
Keep getting together, yeah, that's good.
Now, show me the shoulder. Where are you feeling most of your discomfort?
It's right here.
Okay, so.
Yeah. It's like, I think it's kind of where some of my ribs are.
Right in the middle of the back here. Yeah, I understand. That's kind of getting a little shifting going on in the abdomen there, so that's going to cause some pain right there. All right. So what I want to do is let's take a look here now. Let's bring this arm up for me. Hold it tight. I'm going to push down. Try to be as strong as you can. Kind of weak in there. Let's bring this one up. Get a baseline. Hold tight. A little bit more power on this arm. I can feel that. Let's do a little tricep work. Push up as hard as you can. Nice and strong. You couldn't even do that when you first started. Okay. So now you notice how it's changing?
Yeah, for sure in my neck.
Just basic and strong. You got a little weakness at C5, but let's check some strength in the hands. Hold tight for me. You got full power.
Yeah.
I can even feel it in the grip. Do a little finger pull here. So it looks like it's just going to be mid-neck that I got to fix today. And then we'll release that mid-thoracic. And because she's pregnant, we don't go face down, we go on her back. So go ahead and lay on your back for me here. And then once we get you adjusted, we'll get the tape going. All right. And we have been seeing you every week now for the last couple months, just through the pregnancy.
Yeah.
Hold tight, which is how I work on my patients. Hold tight for me. A little weak on that one there. Hold tight there. A little weak there. Let's do the adductors here. Squeeze the legs in tight. Pinch really hard. That's firing good. Keep them up. We're going to do the adductors here. Let the legs drop out. I'm going to push in. Hold tight. It's got full power there. Back down. Check some of your core real quick. Hold tight here.
Yep.
I got a little weakness up top there.
I don't know if I'm supposed to be holding back or something.
Yeah, hold as strong as you can. I'll let you do that one again just in case.
Yeah.
It's not uncommon to have one of these weak. Hold tight for me. That's weak. We're gonna fix it. All right. So let's start with her neck. Let's just get you, just come out of the massage so you're nice and relaxed.
Mm-hmm.
So let's bring the center here. There we go. Are we all tired of wearing masks today?
Yeah. Always.
Oh, yeah. Nice, easy now. Here we go. I feel good.
Yep. Got a lot there.
That released really well. Let's dig these out here. Here we go. That was good. All right. Now let's get that middle back cleared out for you. So bring this across here. In a position here. I'm going to lift you up a little bit here. Have you been sleeping okay through the pregnancy?
Sometimes. Last couple of days, no.
No? All right. A little tiny one there. Nothing there. All right.
Once I wake up, it's game over.
Is it?
Yeah.
All right. Let's do some more. I'm going to do lower back stuff here.
Okay.
All right. First thing I'm going to do, let traction this out.
You can take my shoe off too, because it tends to fall off.
Perfect. We'll work on your ankles too. Kind of clear up everything for you before we tape. All right. Deep breath here. Here we go. All the way out. A little tiny movement there.
Mm-hmm.
One more here. Good. Let's check and see if I got that one. Hold tight for me. One more time. I'm going to be laying your side facing over here. Alright, here we go. Bring this here. This is really tight right here.
Yeah.
This is what I want right there. A little breath. On your back. I felt it shift. Let's see what the neurology tells us. All the way down. Here we go. Hold tight. That's a win.
Yep, that feels a lot better.
Perfect. Let's go back up here. Hold tight. And even that corrected. And that corrected. What I'm not sure corrected was that rib. So I'm going to have to sit up face this wall.
Okay.
I want you to, first thing I'm going to go is back to the C5. Hold tight for me. See, we're not done there. Still a little weak. And you're having some pain over here. How's that feel? Kind of take a deep breath, move the arms around. You see if it's still catching.
It doesn't, I don't feel it as much right now, but it's
Okay.
still, it does catch like right.
Right
It's like
here.
at the base of my shoulder blade
You
kind
do a
of.
little more. The kind of things we can do and can't do with you being pregnant, it's hard to lay down and get some of these more deeper ones. So I'm just going to work through there a little bit. Now I want you to take your arms across your body, and we're just going to do some rotation. I'm going to turn this way,
Okay.
and I'm going to turn that way, and I'm just going to adjust down the spine as you move to induce motion. Perfect. Keep going. Good. Keep going. You feel anything catching?
I did just a minute ago.
That's good. Go back to center rest. I'm going to switch tips. Put the arms rest. Take this one across the body this way. Back to center. I'm going to go right to the red hips here. These kind of release these kind of easy. Feels good. Let the left arm drop. Do the same with the right arm. Bring it across your body. I'm just opening up this area here. And then go right down the lateral spine here. Is that pressure okay?
Yeah, that's fine.
There we go. Let your body relax. And then one other technique. I like this one. Just drop this up there. Because that's catching in there, it wasn't letting go. I'm using a lot of tools on you today. Now, we're going to go good posture here. I'm going to put this on the side. What we're going to do is roll up the spine with our roller. And just walk it up. And this tends to help the vertebrae relax and adjust in that way. Is this pressure okay?
Yeah, that's fine.
Sometimes you want technology to help us out. There we go. Now take your thoracic spine through a range of motion. Just see if it feels like it's still hung out.
I can't feel anything at this moment.
Perfect.
Yeah.
All right. Now I'm going to go back, feeling anything obvious. Maybe a little restricted right here on the right.
Yep.
Right there.
I feel that.
Yeah. But this is the one that's weak though. Hold tight for me. You got no tone on that. I'm not even trying. You can't even hold that. Let's try it this way. Hold tight for me. And this one is strong.
That's interesting.
Yeah, well, we follow the neurology. We don't follow the symptoms. So we're going to go over here. We're going to try to traction out that C5, C6 on your back. So let's drop down.
It doesn't stop growing. Stop.
Do you want even longer hair or you just have a...
I just haven't cut it
You
in
haven't
like
cut
2
it?
years.
It's awesome. Do you ever think of donating hair?
Oh yeah, I could. I probably will the next time I cut it.
That's awesome. Okay, I'm going to lift up. I'm going to scoop it. Okay, and now go ahead and drop down. Perfect. Here we go. We know we're stuck. C5, C6 on the left is not firing. Take a little breath. All the way out. Good, good. That moved.
Yep.
Yeah. Let's try it. Come on. Good. Perfect. Let's see if that was enough to get the tone back. Hold tight for me. What do you think?
Yeah.
Yeah.
It's a lot better.
I like it. All right. From this position, let's go ahead and kinesio tape the back.
Okay.
So we're going to roll up the shirt here. Let me get the tape. And we're going to bring it up to here. I'm going to gently roll this down.
Yep.
We're going to tape here to support the lower part of the back. And then we'll be taping the abdomen next. What kind of things do you feel with the tape on your back and how it's helped you?
I think that I feel like held in.
Okay.
So when my body, it like almost kind of assists, is like this small extra assist when I'm like sitting up or when I'm doing something.
Nice.
It's just like a little bit more held in.
Okay. So I'm going to have you very comfortably roll forward naturally. Good. Now I'm going to apply a little bit of a stretch on this tape. There's 0, a little bit there. Perfect. Now smooth that out. Get back up for me. And then we're going to now get nice little wrinkles. Now we're going to support. That's the joints right there. So many different variations of a theme that we can do that helps the people here. So I'm gonna support the center here and then pull out. I'm gonna pull the sacrum back in. And I'm gonna apply the stretch. And then no stretch on the anchor here. So that way the fiber is pulling, muscles pulling in this way. Stretch over there. this up onto your back. Get comfortable there. Now I get my assistant in here. So let's go ahead and get that belly. And then we're going to go ahead and tape may happen first. So I need you to hold down there for me.
Okay, sir. Makes that nice move, nice move.
Perfect. The other one here. Pull that down for me. Alright, now the more complicated ones. So I'm gonna have you hold over here, hold the clothes down for me here, and then perfect. Here I'm gonna do the broad ligaments here with a larger strap. Sometimes we use the same tape, but this time I wanted to try a larger piece and just give you some feedback and see if that helped you.
It's bigger and bigger every week.
So now, I'm gonna pull it down more, right to the bottom here. I'm not gonna put a lot of stretch on that. We're gonna go on this way. Perfect. Like a big Christmas present. It's nice to find things that help, but I want to make the taping look really cool too. Gotta have uniform and balance to it. So again, we're gonna drop it here. Once again, really I'm not doing big stretch, I'm just kind of, just a tiny bit. We're gonna follow it around and bring it up. I got a little stretch in there, but this is an experimental one anyway. We're gonna see how that supports these ligaments in here. And just give me feedback. There's a couple other variations we can do, but I really wanted to show. So this is how we do some taping for pregnancy. And there's cross ones we can do, broad ligaments, round ligaments, all kinds of things all through here we can do. And then we support the low back and see what the patient feels like. All right, so come on up. Make yourself comfortable there. I want you to walk around for just a second, take some deep breaths, see how your body's feeling.
I mean, so far so good.
Yeah, we're just finished. All right. So let's finish up with your feet.
Okay.
I'm going to adjust your feet real quick because I know feet get tired.
Yep.
So go ahead and lay down for me real quick.
Like this?
Yeah. A woman's feet are tired at the end of the day when she's pregnant. So a little extra bonus today is both legs all the way down. Is I'm just going to do a little scraping because I know that as you're gaining all the weight and sitting and working, your feet get a little sore. So I'm just going to loosen up all the muscles and tendons in that foot. This will probably send you home to take a nap.
Yes. That sounds just fine.
I can feel a little bit of a kind of a gristly stuff in here. You don't have to be on your feet too much during the day, do you?
I don't know.
That's good. Let's just kind of release this one. Yeah. There you go. I can feel that one. That's not too hard, is it?
No.
I don't want to go too hard. All it takes is just a few minutes to get those feet to relax a little bit. And of course, we'll do this again next week. There we go. All right, perfect. Clean the feet, adjust the ankles. And then you'll be off to play. And hopefully you have a fun weekend with your family this week.
Yeah, definitely.
There we go. Nice. Last one's here. Good. Let's clear these. Good. Everything feels good. Let's see if anything moves here. You do a lot of note taking.
Yeah, I do.
Not too bad there.
And I'm left-handed.
And you're left-handed?
Yeah.
Here we go. Not bad.
Nice.
Now I think you can go play.
So I would definitely recommend if you are in a space where you're really needing some help with feeling aches or pains or things like that, and especially if you're in pregnancy, this is a great option to help make that pregnancy a little bit less less of a struggle, I suppose, in small ways. So I would definitely recommend Advanced Family Chiropractic Center.